No comment, sir.
Start from the beginning. Go to the beginning.
Okay. Good afternoon, Professor. My name is Adeshe Nuruddin Olaide. I'll be presenting a topic on the prevalence and determinant of malnutrition among under 5 children in Kwara State, Nigeria. This is being supervised by Professor Best Odinawar. Background to the study. Malnutrition is a major global public health challenge characterized by malnutrition. We have stunting, wasting, and the underweight, overnutrition, and then micronutrient deficiencies. Malnutrition during early childhood has lifelong consequences, including impaired physical growth, cognitive development, educational attainment, reduced productivity, and increased mobility and mortality. In some Sahara Africa and Nigeria, they bear a disproportionate burden of child malnutrition globally.
About 1.8 million. What's their aim and study objectives? Sorry, we don't have a lot of time to.
Okay. The aim is to determine the prevalence and determinant of malnutrition among under 5 children in Kwara State, Nigeria. And the objectives are to determine the prevalence of undernutrition among under 5 children in Kwara State, to evaluate child-related factors associated with undernutrition, and to examine maternal nutrition.
Hello?
Yes, sir.
Listen, that's not now. So how it seems we didn't look, we didn't see these objectives. We didn't see these objectives.
It was.
We didn't see them. We didn't see them. I don't know. I don't know. These are not how those ones are associated now. To determine maternal factors, including maternal and nutritional status. How are you going to do that? When this study is about the nutritional status of under 5 children, you are assessing the nutritional status of their mothers. Eh? So what are the determinants of the nutritional status of a child? Okay, sir.
Sir?
So what do you think are the determinants of the nutritional status of a child, of under 5 children?
We'll be looking at their sex.
Sex determines nutritional status.
Nutritional status. No, looking at their BMI, sir. Looking at the body mass index, sir.
For under 5 children. What is their background?
Biochemistry, sir.
Oh, what if so now? But these things, when you are told, when this thing, you try and understand. So what is it? I don't know. And you put my name there. Doesn't mean nutritional status. If somebody is feeding I think one of those things is that the person has to know. Do you know that people have nutritional needs? Nutritional needs. They have the nutritional status is based on the knowledge of the nutritional needs of under 5 children. We have these things. You people, you just disappear and appear with a topic like this. And the funniest thing is this: I don't know if you had a proposal presentation. Do you have a proposal? Did you have a proposal?
Yes, I had, sir.
They didn't correct these objectives.
I was referred to you. I sent to you, sir, and you worked on objectives for me in the.
So did I see them?
I resent back, sir.
Did I see them? No. Yes or no?
Sir. Yes, sir. I resent.
And I left them. I saw them and I left them like this.
You said satisfactory, sir.
No, I'm talking about their proposal.
Yes, sir. You
see, let me tell you, I just saw it.
Yes, sir.
Even if following death, even I have coma, this thing, the telltale signs of my review are not there. are not there. And it means that if I have reviewed it, it means that you didn't look at the in-text comments. Because those are the things. I don't read a lot of what you people send, but I concentrate on the specific objectives. You do the specific objectives well. But how can you be assessing the nutritional status of the under 5 of children and you're looking at the nutritional status of their mothers?
I will expunge that, sir.
You have done your work. Let's go to your methodology. Let's see what you and your results. Your results. Me, I'm not going to kill myself.
Yes, sir.
No. Let's start with the study area. Let's start with the study.
Okay, sir. So it was
okay, that is it.
Yes, sir.
And then the statistic. So move on to the next.
Okay, sir. Yes, sir. So this is the
inclusion and exclusion criteria.
Yes, sir. Yes, sir.
Usually ill and is not a biological mother. It's not a biological mother. Look at this exclusion criteria. Do you know what caregivers are?
Yes.
So what are caregivers?
Those who are, let's say, the mother, or those who take care of the
no. Those who take care of the child. They are called caregivers. Sir. Naturally, they are not their mothers. So if you include them, if you included them in your specific objectives, why will you go and exclude them? Why will you put biological? And this is public health. This is public health. Public health, you don't know. I'm sure that you grew up in a community. The children are not taken care of by their mothers. They even have house helps that even do that provide most of the care. And you move on, just move on. You have done your work. You have done this work. And this work will be, that is how let's just see what we can do. And then you send it to the external examiner, no problem. You will go and face the external that way, since you want it that way. Move on to the next.
So the sampling method, sir. So
the sampling.
Yes, sir.
So we cannot see any of the sampling method. You said it's in Kwara.
Yes, sir.
Kwara.
Yes, sir.
It's Kwara. You are using this senatorial. So if you using senatorial zones. Anyway, that is what you used. You used senatorial zones. If you certify and you selected 2 local government areas, it means that when you step it down, you are going to conduct the study in at least six communities, which I know that you didn't do. You didn't do. So, these things, this year sampling method was cooked up. You didn't do this study in 6 communities. You didn't do this study in 6 communities.
We went, sir, and even
That's
at a point we went to facilities.
Don't worry. No. You are not. You are even complicating it. Community-based study is different from facility-based study, and this is our work. This is our MPH. This is our program. You see, but you sound like a young man.
Yes, sir.
Like a young man. It gives you the opportunity. If you should have this certificate is just a paper, but what you can make of it is the knowledge you acquired in terms of in course of the training. I have a daughter that did biochemistry, and although she is in nutrition and her knowledge of dietary management of diabetes is top notch. And this one now, so you have not given time to this work, and you have not given time to understand these things, so that at least when you have an MPH is even a professional degree. MPH is probably used to be is the highest professional degree in public health. Once you have an MPH, you can be employed. You can be given almost the same kind of work as a medical doctor in public health with an MPH. So that is the thing. So the first one, this first stage, since you wanted to go through using the senatorial zones, but when you are talking about nutrition, it is about rural urban, because the determinants of nutrition, they are according to the rural urban consideration is better, not the what is it called now? The senatorial zones. But you have done senatorial zones. But please don't tell us that you selected two LGS. You selected the least we can get is that you selected one LGA each. That is a total of three LGAs. And from the LGA, you selected one ward, a total of six wards. And then from each ward, each of the selected wards, you selected one community, so that to make it still a total of three communities. Sorry, a total of three communities. And then you select the respondents using systematic sampling method from those 6 communities. But even at those communities, anybody that sees it will know, because you are going to do community entry. You are going to go into the community, meet the KBSC and all those people to grant you access to those communities, and you do the study there. And it takes a lot. It's a lot of logistics to do it in 6 communities when you can do it in 3 communities or even 2. If you are used rural urban, it could have been 2, and it could have been more credible. It could have been more believable. But this one, you said you did it in 24 communities. Falsehood, cooked. And the funniest thing is that if you want to cook a result or you want to cook a study, why not to have the knowledge? Why not know the implications? Okay, sir, please make those corrections and move on. Let's see this thing. And how did you even assess the nutritional status? How did you assess the nutritional status of the children?
I can't get you, sir.
How did you assess the nutritional status of the children?
Okay, so we measure we take their measurement.
Which measurement?
The height, the weight. So we calculated their BMI, and then we use
you calculate BMI for under 5 children.
No, we use the information gotten from their.
I'm asking now, Augusta. No, yes, did you use BMI to assess the nutritional status of under 5 children? Is that what you use?
No, I'm talking about the process.
No, I'm asking you. I asked you, how did you assess the nutritional status of the children? And you are telling me BMI. How is acute malnutrition measured amongst under 5 children? It's weight for age. Wait for age. Well, how do you measure stunting? Stunting. Chronic malnutrition. How do you measure it? You know, I guess if I tell you that I'm not disappointed, I'll be lying. But let's just see our results. Let's see our results.
Okay, so
Let's see.
Because I was about to say that, I was about to say
Just,
we use height for age
just
index
don't
to
worry.
measure
Just,
the. Yes, sir.
don't worry. Just let's
Yes, sir.
see a result now. If you measure it with height for age, then we should see it.
Okay,
Move,
sir.
move to your, let's see a result. Let's see a
Okay,
result.
sir. Okay, sir. So this is the
Move on.
response rate
Move
from
on.
the.
Move
Yes, sir.
on.
Okay, sir.
Is the marriage. Okay, move on. Move on.
Okay, sir. Okay, sir.
Move on. Move on.
Okay, sir. Okay, sir.
See the social demographics. I'm looking. Look at what you stated now. You stated nutrition, and where are you for nutritional status? If you are measuring weight for age, you should give us the proportion. Give us stunting. How many? What's the proportion? And look at your wasting. The person, if you are the one, and just move on. Move on.
Yes, sir.
Okay, go on. Move on.
Okay, sir. Okay, sir. So,
Move on. I really don't know what will be the decision now. Dr. Moore, what do you think? What do you think? Well, this guy wasn't supervised, though. He didn't. He went rogue. he went. He went solo, and he did his work. He did his work. Either he did it or he contracted it to somebody, to an idiot, somebody that know less to nothing. It's either so I don't know. I think it would be more pleasing to me that you did it yourself. But if you had given it to a person, it's even more annoying that you gave it to an idiot that wrote that. Yes, so it's even annoying. And the thing there is this: if I have seen signs of my input into this work, I can say, let me share in the blame. But because I put a lot of emphasis on the specific objectives, because it's the most important thing. Perhaps if you have listened,
I should go and redo it.
if you have gotten those specific objectives, you assess knowledge, you assess attitude, you assess their feeding practices. If you want to add household food security, you add, and then you determine the nutritional status, and then you the next objective with the factors associated with the nutritional status. They are more focused, but he was all over the place, and he has finished his work. And I don't know. I think you can just say it's time up. You can just say it's time up, which means that you can just continue and finish. Continue and finish. But if he concludes this program, he has not shown that, he has not reflected anything that we taught him. So I don't know. We are in a dilemma whether to allow this guy to complete his program, or whether to hold him down. But as a young guy, this is postgraduate education is self-training. You train, you are the one. Even those of us that went as a medical doctor, a lot of times most of our lecturers went to Saudi. So we didn't have enough. But The exams were based on the curriculum. So you don't even depend on what you were taught. You had to read, you had to go and and we are looking for the biggest textbooks to read, because we knew that once you cover that textbook, you are sure of passing. But this one, you are not, you won't say you are not taught. You are not, you won't say. But even at that, you are given a topic and you didn't read about the topic. Okay. So I beg, I don't know. So this way, you go and make the correction, whatever you want to make, the corrections you want to make, and then
Okay, sir.
send it straight for the external examiner. Send it straight to the external examiner. I'm not not fair. Not fair to the school. We gave you this opportunity. You just decided not to even do anything, to just use it. You are just interested in the certificate. And you have it. You get their certificate. You get their certificate, but you have not learned anything. It's all right. We can't kill ourselves. Please, can you stop sharing? Stop sharing.